Good afternoon, ladies and gentlemen. This is Nati Carrillo. I am a health coach, and I will be talking to you about several conditions and what it is that I do and how can I help you to be a master of habit change. First of all, I want to start off by saying that I myself hated running. I hated walking. Running is still a challenge for me, but I do walk, and I have been running my first marathon, which I never thought I would do, was done in 2.5 hours for 13.1 miles, which it was a big accomplishment, and that is a proof that this program works because I went through it from my health coach that I had as a mentor, and she was a great guide and helped me a lot through what it is that I had to do to develop healthier habits. So, with no further ado, the topics that I will be discussing, and I will be defining each one and telling you the causes and effects and the management where appropriate. I'll be talking about stress, fatigue, obesity and its complications, depression, anxiety, and then the last slide would be what it is that I do as a health coach and how I can help you and how to get you to reach out to me so that we can have that discussion to see if you are an appropriate client for me or if I am a coach for you. Um, Now, stress, first of all, we've all experienced it, and sometimes our body does not actually tell us, or we feel that it doesn't tell us, you know, because you can go about your day and you feel great. However, if you are having uncontrolled blood pressure, blood sugar, or you're not sleeping well, your body is still under stress. That we have to understand. So, stress is a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. Working 12 hours a shift every day. Um, the body perceives stressors as real danger. So, what this means is you're in constant fight or flight if you're under stress. The body does not know whether the difference between if you were being chased by a bear or you're working as a nurse per se in a 12-hour shift without eating, without going to the restroom, a highly stressful environment. So that you have the same symptoms as you do when you're being chased by, or when you see something that you are scared of, let's say a spider or a snake. All of that puts you in the flight or fight response, therefore increasing your heart rate, your blood pressure, decreasing your absorption in your GI tract. So all of that is a consequence of you being stressed out, and your body, you'll have constipation, you'll have lack of sleep. So the real danger versus daily life stressors, that's what the body does not distinguish, from your daily routine, your daily life stress versus a bear or lion chasing you. So it's basically the same reaction we're going to get. So this is why we want to make sure that we control the stress levels in our life. So a constant daily fight or flight response is the same reaction the body goes through when or if you were being chased by a bear or a lion, okay, or something that you just want to get away from. So, Dr. Carl Albrecht's type of stressors. There's 4. There's time, anticipatory, situational, and encounter stress. Time stress is worrying about time or the lack of time. You're rushing to go to work. That is a specific example. Anticipatory is the stress that you experience concerning the future, a specific event, or you fear that something might go wrong. Let's say you're having a birthday or you're having a party, so you're already anticipating all that you have to do, so therefore you're stressing about it. So your body's under a constant emotional roller coaster. Situational stress is when you're in a scary situation that you have no control over, such as if you get demoted or you get laid off, or acceptance, being accepted in your work environment or with social status. Encounter stress is worrying about interacting with a certain person or group of people that you may or may not like, or that you think they're unpredictable. So these are four types of stressors that we need to know. Then there are the life stressors or triggers to stress. Okay, these are the ones that will cause more of an emotional roller coaster and will increase your blood pressure, your heart rate, give you constipation, restlessness, and sweating, and all this other stuff. First and foremost, one of the major life stressors that we've all been through or know somebody who's gone through is the death of a loved one. That can be a very highly stressful situation. Divorce, loss of a job, increase in financial obligations. You have more responsibility all of a sudden. Getting married, moving to a new home, chronic illness or injury, emotional problems such as depression, anxiety, going through grief, or having a lot of guilt, or having a low self-esteem, traumatic events, any type of abuse, physical, emotional, or sexual. All of those are also stressors. Caring for a loved one with a chronic illness, somebody that's diabetic or on dialysis, or somebody that has dementia, or a loved one that has a certain condition such as autism or hyperactive disorder, while they're going through school. All of that involves some stress, if not a lot. Relationship issues, poor sleeping, your work demands, and if you're unhappy in your job. All of these are triggers to stress, okay, in your life. Then you have the physical symptoms, which gives you low energy, you have headaches, you have a stomach upset, including diarrhea or constipation and nausea. You have aching pains, tense muscles, chest pain or rapid heart rate, insomnia, which is a lack of sleep, frequent colds and infections because you're more prone because your body's under a lot of stress, loss of sexual drive or inability to have sexual interactions. So, these are all the physical symptoms of a stress response. Now, you can have diarrhea and constipation because of irritable bowel syndrome. When let's say you're going to have a presentation or something and you notice you're going to the restroom, you're having that type of reaction versus also constipation. Everybody's different and everybody reacts differently to stress. So the effects on your body of stress increases your cortisol production, which also increases weight gain. You have increased inflammation in your body, so you have more muscle aches and pains. You have more gastric emptying time. So this can also make you more prone for infections. Increased nutrient secretion, increased sodium and fluid retention, increased food sensitivities, increased blood cholesterol, increase in blood platelet aggregation, the clotting mechanisms, increased insulin resistance. You have an increased erratic function of your lower esophageal sphincter, therefore giving you heartburn, bloating, a lot of gas, increased oxidative stress, increased risk of osteoporosis, and then you have you have a decreased gut flora populations because of the high acidity environment in your stomach from all the stress and the acids producing. You have decreased emptying time also, which is like I told you before. You can either have diarrhea or you can have constipation. Decreased nutrient absorption, because if you're having diarrhea, then your vitamins and everything is not being absorbed properly. You have decreased hydrochloric acid production, decreased growth hormones, decreased thermic efficiency, decreased thyroid hormone, and decreased sex hormones. Okay, so the management of it You want to exercise and or move. Your body needs movement. It was not made to stay in one place. So we have to move on a daily basis. You want to walk. Walking 30 minutes per day for 5 days a week is usually what was recommended. Now they're starting to recommend more of the 10,000 steps, which equals up to like 4 miles, depending on your steps. Um, Running, biking, dancing, rollerblading, yoga, golfing, tennis, any kind of activity that you will move. Okay, that's very important. If you want to lose weight, which is a biggie, you want to exercise or walk at least 1 hour a day for 5 days out of the week for minimum. Okay, if you walk every day an hour, that's perfect. But you still want to make sure that you're burning calories and you're not consuming too much calories compared to what you're expanding, what you're burning. So you can take an afternoon nap of 30 minutes, which is what they call a power nap. Believe it or not, that does help, and more research shows that it is recommended so that you can wake up rejuvenated and more focused. If you're at work, you want to take a walk outside, get some fresh air, just to decrease your stress levels. You can also play with a pet. Animals are proven to be good therapy. Meditate and or pray. Okay, those are also very effective in managing your stress. Meditating 10 minutes daily, just that alone will help you to refocus on your daily life. Listening to music, listening to a podcast or audiobook, reading a book, or even writing your own book, or practice journaling. A lot of people write down their emotions, their daily to-do lists, and that is very important also, so that you're more organized and you have less stress throughout the day. Fatigue is another topic, okay, which you'll find out that these three topics that I'm talking about are all involved in some way with the same symptoms, and it's hard to tell which is which. Therefore, this is where your coach comes in to try to be more specific and identify where it is that you might need the help. So fatigue is an extreme tiredness resulting from mental or physical exertion or illness, a symptom often difficult to describe in words, and it's often described as being lethargic, exhausted, run down, and just tired. So there are several types of fatigue, believe it or not. There's lifestyle, physical, mental, and emotional, or both. So the lifestyle causes of fatigue is the physical exertion. Let's say you went to run and you just ran too much, you overdid it, or you cut the yard and you were outside in the sun for too long, didn't drink enough water, and didn't allow your body to rest in between. So that's physical exertion fatigue. Lack of physical activity, believe it or not, if you're sitting around doing nothing or just walking 500 steps a day, that can also give you fatigue, which is sort of related to boredom. Okay, that's another cause. Being overweight or obese is the cause of fatigue. Periods of emotional stress, and depending on how much you're exposed, also you can be more fatigued. Grief, taking certain medications such as antidepressants, sedatives, or water pills also can give you fatigue if you're not hydrating well. Alcohol on a regular basis, and illicit drugs such as cocaine. Consuming too much caffeine, and not eating a nutritious diet. All of these are lifestyle causes of fatigue. So we go to the physical causes of fatigue. You have anemia, which is a low hemoglobin. You have lack of oxygen hemoglobin in your blood, so you get very tired or short-winded right away, or even dizzy. Vitamin B12 deficiency. You have vitamin D deficiency, which causes muscle aches and pains and an unexplained fatigue. you have a level less than 30, that is very significant. And also adrenal fatigue. Autoimmune diseases such as diabetes, rheumatoid arthritis, hyperthyroidism, hypothyroidism, and Addison's disease are also some causes. So you want to make sure that you're in communication with your healthcare provider to know um, what the cause of your fatigue is first and foremost. As we always recommend that to do, always check with your provider. Cancer and or the treatment of cancer, infections, fever, inflammation, or skin infections, sleep disorders such as insomnia, obstructive sleep apnea, if not treated properly, eating disorders such as anorexia, heart disease such as congestive heart failure, kidney disease, liver disease, and osteoarthritis. COPD, which is chronic obstructive pulmonary disease. Even asthma can also give you fatigue. Emphysema, stress, here we go again, overproduction or a depletion of cortisol and other hormones leading to the adrenal fatigue syndrome. Toxins, what we have in our environment, in our water, in our soaps, and in our food, okay? So we always want to try to get products that are toxin free or have less chemicals, especially people that have allergies. Long-lasting complaints of fatigue of more than 6 months is called chronic fatigue syndrome. So you want to make sure with your provider first and foremost, which is normally what we recommend, your physical exam to be up to date. And if you have any concerns with a chronic disease, I will look at them, but I will not prescribe, and I'm not doing any of that. Okay, this is pure health coaching to master habits of healthy habits. So then we go to the mental causes of fatigue, which are anxiety, depression, and seasonal affective disorder. For the anxiety, of course, there's several types. There's generalized anxiety disorder, there's obsessive compulsive disorder, social phobia, post-traumatic stress disorder, and panic disorder. Depression, which can be a mild, moderate, or severe. And there's other types of depression, which you have major depression, persistent depression, which is lasting more than 2 years, postpartum depression after you've had your baby, psychotic depression, and bipolar, where you have your ups and downs. Seasonal affective disorder is getting more down or sad during the winter months, and that is quite common. So the effects of fatigue on your body, of course, tiredness, digestive issues such as irritable bowel syndrome or acid reflux, heartburn, bloating, difficulty falling asleep, especially around 10 p.m. and then you wake up very early in the morning. Craving sugar and caffeine during the day, unexplained weight gain, brain fog, low energy, you have hair loss, fluid retention, and mood and sleep disturbances, which are secondary, sleep disturbances, secondary effects of fatigue on the body, usually. So that's why you have to rule out that you don't have anemia, the B12 or vitamin D or hyperthyroidism, and all that requires lab work. So that's why we recommend you go to your provider. Managing the treatment for fatigue, which is you always treat the underlying cause, as I said, with your primary care provider. For the anemia, you're gonna have to draw the labs at your doctor's. Okay, they're gonna have to assess and evaluate for any bleeding issues or any kidney functions, give you iron supplements if you need them, and then recommend iron-rich foods if you're anemic. For B12 deficiency, you have the B supplements. For vitamin D deficiency, you have vitamin D. Okay, the metabolic hyper and hypothyroidism, of course, you go under the care of your primary care provider. We don't do anything with that. We just tell you that that can be, if you haven't been diagnosed, it can be one of the symptoms that you're having if you're having fatigue and constipation. that's when we refer you back to your provider. If you're not, you have to sleep well, okay, to avoid, to manage the fatigue. You have to avoid excess caffeine or cokes and tea. Eat a nutritious diet, and take your medications for your congestive heart failure, because if you don't, then that's when you start gaining weight and you get even more fatigued and coughing. But anyway, that's specific to CHF, which we're not going to go into. Um, Depression or anxiety, you always want to treat that first, also with your provider. So, because if you're not treated, then you can always be tired and always anxious, and then we're not going to be able to go anywhere with your action goals. The other is obesity, okay? The National Institutes of Health says that the BMI, body mass index of 30 and above, is considered to be obese, and normally you're usually 30 pounds overweight. Having an unhealthy amount of fat, putting your health in danger. Okay, this is what the obesity second part definition is. So body mass index is a simple calculation using your weight and your height, and it's the formula for the BMI. It's the you take your weight in kilometers, and then weight in kilometers in a person's, and then you do the height in meters square. So you're going to figure out that formula. And there is a BMI calculator online, very easy. You just type in BMI calculator, put in your height, your weight, and then it'll give you what your body mass index is. Okay. The healthy ranges are 18.5 to 24.9. This is a healthy range. 25 to 29.99 is overweight, and 30.0 is obese. And why do we want to control obesity and our weight? Is because you're going to be at an increased risk for type 2 diabetes, heart disease, high blood pressure, arthritis, sleep apnea, some cancers, and even strokes. So the causes of obesity is physical inactivity. This is why movement is very important. When you're overeating or consuming an excess amount of calories for the ones you are burning, genetics also plays a role, so we have to be very alert to and sensitive to that also. A diet high in simple carbohydrates, the frequency of eating is more than well, not, I don't want to say usual, but it's just the frequency is more. Medications, some of them can cause weight gain. Psychological factors and diseases such as hypothyroidism causes weight gain if you don't have it controlled, insulin resistance, polycystic ovary syndrome, and Cushing's syndrome. Okay, so there is a chart, an image on Google, which I get, and it's called medical complications of obesity and the effects of obesity on your body, which it'll give you pulmonary disease, okay? You have abnormal function, you have sleep apnea, okay? Hypoventilation syndrome. If you're a person that snores a lot and then wakes up in the morning with a fog brain, like you're dazed, you're always yawning, you can sit down and you like fall asleep right away. You have a headache, your blood pressure is not controlled, you have constipation, you have dry skin. All of that can be a result of sleep apnea, so you have to check yourself with your doctor. Also, non-alcoholic fatty liver disease, believe it or not. This has been more prevalent in the younger population now, so you want to make sure that your diet is low in saturated fats and not fried. There's also steatosis, steatohepatitis, and then leading to cirrhosis. So you don't necessarily have to be drinking to get cirrhosis. You can have fatty liver, and it advances to cirrhosis if you do not take care of it, okay? Gallbladder disease, gynecologic abnormalities for women. You have abnormal menses. You could have infertility if you're obese, and polycystic ovarian syndrome. osteoarthritis because of the weight that your joints are carrying, especially the lower back and your knees. Skin infections such as phlebitis, venous stasis, gout. You have an increased amount of uric levels. Idiopathic intracranial hypertension, which is um, pseudotumor cerebri. That's what that one is. And you can read up on it more. I can't go into detail because I'm already going over what I wanted to go over in time. You're at increased risk for strokes. If you're obese, you're increased risk for cataracts, coronary artery disease, and of course, diabetes, high cholesterol, and high blood pressure. You can have severe pancreatitis. You're at increased risks. You are also at increased risk of having several types of cancers: breast, uterus, cervix, colon, esophagus, pancreas, kidney, and prostate. Okay. So very important to control the weight and lose some pounds if you need to. Okay, then that one. Management. Okay, so treatment, of course. You want to have a long-term plan for making lifestyle changes. You want to develop healthy habits. You want to make sure your routines that are causing you to have a long-term unhealthy consequences become better choices. Okay. Build healthy habits that last, which is where coaching comes in. You have the right system, support, and accountability in your health coach. You have to have increased activity to treat obesity. Like I said, walking for an hour for 5 days out of the week is recommended if you want to lose weight. Incorporate healthy coping mechanisms that empower yourselves. Because believe it or not, we have the power. We just sometimes go into an emotional domino effect. When you're upset, you go and you eat. Even when you celebrate, you go and you eat, right? You're at a party, so you eat more than you normally would when you're at home. So we just want to make sure that we know how we're being when you're eating, just more aware. You want to limit red meat, okay, to once or twice per week, preferably once. Being present during your meals, like I said, chewing your food at least 20 times is very important. 20-minute meal method. It's setting your timer when you start eating, and then chewing your food, putting your fork down, taking a deep breath, because oxygen helps with the digestive process, therefore having less constipation. And then you want to make sure the timer goes off at or very close to 20 minutes, because that's how long it takes for your body, for your stomach to send the messenger to your brain that you are full, and then shutting off the hunger hormone. Okay. Treat any underlying depression, anxiety, or psychological factors, of course, with medicine or surgery. Sometimes is indicated. Okay. Bariatric and gastric bypass is also indicated for people that have the insurances and that do qualify. But this is related more to health coaching, so I'm not pushing for surgery in this. It's just I'm telling you how to manage. There are the options for the management of obesity. And then the last ones I have is depression. So for clinicians, they always diagnose you with the PHQ-9, which is the health questionnaire for the severity of the depression. And feelings of severe despondency and dejection, okay, was the definition I found. So I looked up despondency because I need to simplify it. A state of low spirits caused by loss of hope or courage. And then dejection is sad and depressed state, low spirits. So depression is a mood disorder that causes a persistent feeling of sadness and loss of interest and can interfere with your daily functioning. That is the key. When your depression or your sadness or your anger, because anger can be depression, anger toward inward. I know there's another way to say it, sorry. Um, um, so yes, when it interferes with your daily functioning, your daily life, that you don't have the desire to go out, you're just in your room, you're always sad, you're very negative, or people may think that you're rude or miserable, but it's just that you do not have that desire. So then you're depressed. So um, research suggests it doesn't spring simply from having too much or too little certain brain chemicals. Okay, there are many possible causes, of which faulty mood regulation by the brain is one. An influx of cortisol triggered by depression causes the amygdala, amygdala to enlarge, the part of the brain associated with emotional responses. Okay, this is that part that enlarges. Decreased levels of serotonin, which is the hormone that regulates the mood, happiness, and anxiety. Genetic vulnerability, if you have a past history in your family or a close relative, you could be at more increased risk. Stressful life events such as a death or a loss can also trigger depression. Abuse, past physical, sexual, or emotional abuse, can increase the vulnerability to clinical depression later in your life. Certain medications, as far as medical, like chronic pain, people with fibromyalgia sometimes have a mild depression. Chronic illness, dementia, multiple sclerosis, cancer, HIV, lupus, and diabetes, usually uncontrolled. Um, so depression symptoms: feeling sad or empty, feeling hopeless or helpless, you feel worthless, you have a feeling of excessive guilt, no pleasure in activities that used to bring you pleasure, you have anger or you're more irritable, you have fatigue or lack of energy, you have insomnia or lack of sleep, you have aches and pains all over, overeating and weight gain, you have also on the other spectrum lack of appetite, poor memory, concentration, and poor decision making, thoughts of death or suicide. Now that's under the severe depression. So if you have that, there is a 24/7 hotline number, 1-800-273-8255. They can talk to you and chat with you at all hours. And then there is the Suicide Prevention Lifeline website also. And I have this all in a PowerPoint, so if you want it, you just message me to do this message, and then I will send you the PowerPoint that I read all from, okay? So the screening, of course, I told you was a PHQ-9, and that's done by your providers, okay? And then there is the scoring from 1 to 27. 27 is severe, and that's already you needing treatment. I do have the parameters, but I'm not going to go over them because I'm not supposed to be, well, it's education. But since I'm not prescribing or anything, I can just send you the PowerPoint, you read it off, and if you go to your clinician and they do that questionnaire, you can ask them for the number and you'll know what this means. You can have also the postpartum depression is always is common among women, so it's always better to follow up with your gynecologist so that they can do the assessment or evaluation. And then the seasonal depression screening also. And then again, I have the suicide hotline number. The last one is anxiety. Okay, some anxiety is normal. It's expected, but a feeling of constant worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome, is not. Okay, this is on a daily, every second of your life that you're constantly worried about something is not normal. So they also have a generalized anxiety disorder scale that the provider will ask you. Excessive anxiety and apprehension occurring more days than not over at least a 6 month period is characterized as generalized anxiety disorder. So the causes are not fully understood of anxiety, but life experiences such as traumatic events appear to trigger anxiety disorders in already prone individuals. Inherited traits can also be a factor. Medical problems that are linked with anxiety can include heart disease because of, fear of having a heart attack, or if you've had one, fear of having another, or congestive heart failure, which is also um, you feel like you're sort of drowning, so that causes anxiety. Diabetes, when you have uncontrolled diabetes, the sugar's not going to the cells where it's supposed to for the energy that you need to think, to go to the restroom, to see, to talk or focus. So then there's a lot of apprehension there. Any thyroid problems, such as hyperthyroid especially, gives you an anxiousness or restlessness. Respiratory disorders such as chronic obstructive pulmonary disease or asthma, because I've seen people that can't breathe, or even myself when I've been sick in the past, getting your breath is hard when you're having, so you have anxiety trying to breathe. Any drug misuse or withdrawals can cause anxiety. Withdrawing from alcohol, anti-anxiety medications, benzodiazepines such as Xanax, Ativan, all of those have to be weaned off because you can get a high heart rate and other effects. Chronic pain or irritable bowel syndrome, because you're constantly having to go to the restroom, so you're stressed out about, and it also gives you, the anxiety itself also can give you IBS. Rare tumors that produce certain fight or flight hormones, okay, is also another cause of anxiety. So the effects are often somatic, and it includes restlessness, increased heart rate, sweating, trembling, increased breathing, disturbed sleep, gastrointestinal problems such as diarrhea or constipation or irritable bowel, difficulty concentrating, avoiding anxiety-producing situations, muscle tension, and it's often characterized by impairment in social and work functioning. So you cannot work in a social or work setting with anxiety because you feel like something's going to happen. You're a constant worry. Repeated episodes of sudden feelings of intense anxiety or a fear or terror that reach a peak within minutes leading up to a panic attack is a very more severe form of anxiety. So management of anxiety, you want to seek help when you feel that you are worrying too much and that it's interfering with your work, relationships, or other parts of your life. When you fear, worry, or are anxious, that the symptoms are upsetting you and they're difficult to control. When you feel depressed or you're having trouble with alcohol or drug use, or have other mental health concerns along with anxiety, you want to seek help. When you think your anxiety could be linked to a physical health problem, as I was mentioning, all the conditions, and if you have, of course, suicidal thoughts or behaviors. If this is the case, you seek immediate emergency treatment if you're having suicidal thoughts or you want to hurt yourself. 24/7 suicide hotline, 1-800-273-8255, and there's always somebody ready to talk to you. And then there's a Lifeline website, and it's also in the PowerPoint. So, how can a coach help you? Well, first, we assist in losing weight without the tedious dieting and the aggressive exercise. We focus on the inner self, and we empower you to take control of your life and reclaim your body so that you can feel great in it. We try to double your energy, addressing all your health concerns, decrease stress, implementing healthy habits that will last, improve through digestion, heal adrenal fatigue, empower yourself with awareness to control emotional eating, manage chronic conditions and cure cravings, and we help get unstuck and improve your quality of life so you can experience deep happiness with and in yourself. So my contact email is at habitsthatlast@gmail.com. My number 956-536-6966 if you want a free consultation to discuss how I can help you with any of these concerns or conditions. And I'm sorry it's almost an hour long. Mhm. Thank you. God bless. Have a great day, and hope to help you and hear from you soon.